Hi everybody, my name is Rhys Barber. I'm one of the audiologists here at Audiology Associates.
And my name is Taylor Green and I'm the other audiologist here. And there's quite a few videos in this compilation. There's 5 altogether.
5.
Yeah, there's got 3 of mine, 2 of Rhys's. This is mine first. We're alternating, so it's me,
Yeah.
Rhys, me, Rhys, me.
Yeah.
Dead.
You did a wee weird now. His shoes and socks almost came off then.
Cut my toes. I'd like to say at the start as well, guys, thank everyone who kind of give me like well wishes and support for the half marathon I did on the weekend.
Smashed it, didn't it?
Did end up with a personal best. I'm not a very fast runner, but I did manage a personal best. So yeah, thank you very much. It was a good day. It was a good day.
What did you do it in?
I did it in 1:59, which is
sub 2 hours.
Yeah, and I've
good going, buddy. Well done.
The last 7 I've done, I've not been able to go under 2 hours. Like 2:01 was my previous personal best, but yeah, we smashed it. We smashed it.
I did a half marathon now. I think they'd have to count it in days.
Okay. It's tough. Oh gosh. So yeah, going back to the wax removal. Sorry guys. So this patient wasn't feeling completely blocked up, but there was a bit of a like a husk of the ear canal that was in there.
I love that.
Yeah, husk. A lot of dry skin as well, which is basically what we're trying to remove here now. So I've got the fine end on, which is the smaller of the suction tube. If you've not seen these videos before, in our clinic here, we tend to use 2 different sizes. The standard size tube, and then we've got the fine end for all this fine work. So we're just trying to get a good grip on this dry section here. Now they're always really firmly attached to the ear canal, these bits. There we are. And with strong enough suction, they tend to peel away. They tend to kind of shear away usually. But in the worst case scenario, it just peels all the way down the ear canal. It goes right down to the eardrum. But yeah, patient was feeling so much better after. Eardrum looking lovely and clear there. Absolutely perfect. Oh, move the hair out of the way.
Got the hair out of the way. Get out of the way.
So yeah, we've got a little gap there. Again, feeling a little bit more blocked up in this side, but you know there was a tiny little gap there, so not too bad. I think we're going with a standard size tube on this side. Yeah, standard size on the tube generally tends to get a better grip on these bigger plugs, so we're gonna get a good grip, bit of a wiggle, loosen this up. Ooh, look at that.
That's a nice one, Taylor. Oh, I try to keep it together as well. I can see what you do.
I'm not like pulling it out, but I'm trying to keep all that together. Ooh, look at that.
Half a skin. Whoa, that is a huge plug of skin. And there's still more in there. Oh, that would have been a lovely ribbon, I reckon.
That was a little bit just holding it in place.
Is that more skin?
Yeah, you can see at the back there, like it's just holding it in. I was a bit gutted it didn't come out in one go.
That would have been lovely if that came out in one go. Yeah, it would have been difficult to kind of hold it in front of the ear though to get the full picture of it, wouldn't you?
There we are. So this is the fine end now, just to get these last little bits away. You can see that what I mentioned just now, where it kind of holds on, it's attached to the ear canal. So I'm going to try and do this kind of backwards motion here now. I know Rhys has mentioned this on a few occasions, but you don't really want that to start peeling down the ear canal. So we're going to just gently drag along the surface. Just that should tend to, or usually tends to start peeling it away quite nicely. Well, we've got 5 centimeters there.
2 inches of skin. Ooh. Wow, that came out. That would have been mega impressive.
Would have been a nice one.
So this is actually my patient. You can see we've got quite a big old plug as soon as you look in there, and quite a dark plug as well. So it's been in there a little while. Generally speaking, doesn't always do it for everything, but generally speaking, when they're darker, they tend to be a little bit older wax plugs. It's starting to come away. Look at that, it's just lifting from the sides. It's that kind of...
It's that horrible consistency.
Yes, that almost clay, yeah, but slightly softer. It's a funny old consistency. You do tend to find the underlayer is super sticky as well, which is what's peeling away here. So look at that coming up. Oh, it's nearly there. It's that little bit of skin that's holding on. You can see it's peeled at the bottom there. It's gone all the way underneath the plug. Oh, there we go, it's starting to move. I know.
It's good.
They get a little bit stuck on the outside, these ones, don't they? So you've got to kind of really wiggle them on. There we go. Nice little ball of wax, that one.
That's worked out really well actually, because they again can be a bit of a nightmare to remove those ones. They
usually these little flaps of really dark skin that lift up underneath as well, aren't they?
Yeah. Oh, Reece is doing exactly what I was just doing on my last one there now, just dragging backwards gently.
Popping over the top. It's much easier to remove it that way. 5/16 of an inch.
Oh, fair play. 1 centimetre, just short of 1 centimetre.
An easy one. So back to you again now.
Back to me again. So very similar kind of looking one. We got a thick old plug in this one. Quite humid in there as well. You can see it was kind of steaming up a little bit. That's usually where the patients used a little bit of olive oil.
Yeah.
But it can. Oh, I honestly thought this was going to be a lot softer when I started. When I went in with the suction tube. So I've got I've got a good enough grip on here now, so I'm hoping that's going to be the whole thing. Look at that.
Oh, wow. Look at that. I think if you tilted that one up a little bit, I think you'd be surprised the length of that. It would be interesting to see that one on the ruler shot at the end. Stay tuned for the ruler shot, guys, because it'll show you at the end.
This actually is a regular patient of ours in the Cardiff clinic.
Oh, is it?
Yeah, it comes every, I think it's every year, I want to say.
Right.
I think it's every year. I might be wrong, it might be 6 months. But this particular patient has issues with eczema.
Right.
So the ears tend to build up a lot quicker than the average person. So we've got a little bit of a tricky one to get a grip on this one, because it's not quite as round. So I've had to try and grip. It's still quite a long piece. I've had to try and grip like kind of tilt the angle of the suction tube a bit more.
Just to match the angle of the wax, is it?
Yeah, that's it. You got it. Look at that.
Whoa, there were some long ones in there.
It's quite dark there. Sorry, I should have gone a bit closer, but yeah, patient feeling much better. These little tiny bits on the outer edge. Again, I know you've seen a few of our videos, and I know you're probably saying, oh, why don't you just, when you get rid of all of that, there's no problem with leaving those little bits in there, because again, when it's like this, it's not going to go anywhere. But once you've got a nice clear ear canal, there's a better chance that's going to start, migrating and coming out of the ear canal with a little bit of help with some olive oil. Yeah,
it would certainly move its way out. Now I got a much deeper plug here, so this is going a little bit further. So just lifting from the side.
I was going to say, I've probably gone super white on the camera now. Sorry guys, I got a bit of sun shining in my face.
Oh yeah, look at that. Yeah, we've changed our room where we do our voice. I can just see it's catching the corner of my eye over there as well. A little bit of skin holding this plug in, so I've just got to remove the skin first. I'm going to give it a bit of a clean, so it's some olive oil on the way in just then. So we've got this kind of gap at the top. Now, the reason I'm trying to take this piece away rather than work on the big plug is I want to lift the big plug up into that gap. Gosh, desperation, look at that. I've got some inserter going in there. Well, that is solid.
Ooh.
I don't like putting a lot of pressure down there, but for this one, I just couldn't budge it without putting that pressure on. You can see just how solid that is.
Oh, that's a satisfying one though. That's a nice one though. Where you can see that whole thing starting to slide up as soon as you went in there.
It's a little bit stuck. I think I've got to ping off yet. So I've changed that from the Rosen inserter. I've gone in with a right hook now, just because it's a little bit wider on the end. So it does help sometimes to get behind these harder plugs and give it a good pull, but I don't think I can quite get over the top. It's kind of wedged in the entrance to the canal now. You can see I'm trying to go over the top or past the plug. That is just absolutely rock solid. I know. It's like ricochet. It's like a Western. There's people in the corner ducking out the way the bits of wax flying back. Yeah, look at this. I'm trying to roll it, but it's not rolling, as I can't quite upend it because it's too long. And I'm trying to pull it and it just won't pull, so I can't get the angle. Look at the pressure I'm to put on that to get that out. Look at that. Absolutely rock solid. I mean, that is just like a piece of stone.
Yeah. That was deep as well. That would have gone right down to the eardrums.
Yeah, it was almost, I think it was just in front.
Oh.
You can see how red the canal is there, just we've had to irritate it to get that out. But yeah, all that was one big old plug, so an inch.
Just over 2.5 centimetres there on that one.
Back to you again now.
Back to me again now. Nice easy one, this one.
Oh.
I think it is anyway. So we just got this little pebble. Patient wasn't really having any issues with the hearing, but more of a sensation that something was in there. And you can see we've got this little block of wax here. Patients use quite a bit of oil to try and get this out themselves, but there we are. Got the fine end here. That's come away nicely.
That is a lovely, satisfying slide out that recess in there.
Yeah.
So you want.
That's a nice one to break up the patients in the day as well.
Hang on, where is it, Taylor Green? I'm not even going to give you that because I didn't think it registered. Well, guys, thank you very much for watching that video again today. We enjoyed all 5 of those videos. We really enjoyed voicing them over as well. Don't forget, guys, if you do enjoy the videos, you can always, if you don't mind, it would be really helpful for me if you can like, heart, share, thumbs up, anything. It will depend on what platform you're watching this on. It does help to feed it out to other people on the algorithm. And if you really, really enjoy the videos and you want to see more of them, you can also consider becoming members of the channel. That way then you get to see even more videos every single week. You get 2 more days worth of videos on top of the 3 that all the subscribers get as well. So guys, thank you very much for watching our videos today. But as always, take care of yourselves.
Take care of your ears.
And take care of one another. Myself, lovely Mr. Taylor Green. We'll see you again real soon. Bye, everybody.
Bye-bye.